sample menu. This is how a diabetic sample menu looks like. Okay, very important to understand that these all things are like, one size does not fit all. So it's just a gist of what exactly, and this is how a diabetic sample menu looks like. Obviously, the quantity, the calorie consumption is really dependent, and it's highly tailor made based on your individual requirements, and one size does not fit all. So this is something where you need to make sure that it's just perfect for you, for your management. And quickly with the case study, obviously I would like to conclude with the case study. I have the patient, Mr. Rao. He was newly detected diabetes from past 2 years, but his fasting levels were normal. His post-lunch levels were really high. And it's very common complaint. How did I help him? Post diabetes, obviously Mr. Rao used to have only cereals for his breakfast, okay, which are carbohydrate, and carbohydrate in turn increases your sugar levels. So, I suggested him to club protein and fiber. As I mentioned, that they increase the insulin sensitivity as well. So I suggested him to make sure that your breakfast is like cereals, proteins, and fiber, all three in combination. After 2 weeks, of course, by making the dietary changes, and working around his breakfast, obviously we showed a remarkable improvement in his post-lunch sugar levels. Because what he was eating for his breakfast and then going for his post-lunch diagnosis, obviously just because of eating sole sugar, cereals definitely had a very negative impact on his post-lunch sugar levels as well. So this was sorted. It's very important that you need to make sure that you need to correct these things in your diet, and it's a very common thing to happen. Case study 2, I have a patient called Shabnam, obviously type 2 diabetic, 7-year-old diabetic. She was detected with nephropathy. Nephropathy is a complication of diabetes, as we discussed earlier, and her creatinine levels were high. So basically, nephropathy is connected to the complication of kidneys, and creatinine is one of the factor, which is because of the muscle activity what your body takes place. So your muscle, activity produces creatine, and in return it goes to kidneys to form creatinine, and they are excreted. Obviously, because of her creatinine levels increased by 2.5 milligrams, she stopped eating all the milk products. So basically, all the protein eliminated. She started on her own eliminating all the proteins, and this is what was the result. When she came to me, she had lost a lot of muscles, because your body needs proteins to develop and maintain muscles. And because she restricted all proteins, that led to muscle loss, and obviously her creatinine levels went high, because there was a lot of muscle activity which broke down creatine to creatinine. I ensured that 50% of her diet was high biological value protein. So around, I included restricted amount of protein, but I gave her good quality of protein, around 0.6 to 0.8 grams per kg body weight. What was the result? The result was, her muscle toning started improving in 3 weeks, and her creatinine levels also improved. Creatinine levels are basically marked with something your body does not need. So it's not important that you need to eliminate one factor like carbohydrate, or you need to exclude one thing. No, it's like a team effort, where everything counts, every single nutrient counts. It's just about portion. It's just about eating right for the kind of problem you have and the kind of body you're looking for. As a journey, not as a destination. So how can you start this? Make sure that how many pounds do you need to lose. If you're taking any medicines, seek a help of a healthcare provider or dietitian who can help you with a better medical nutrition therapy, and it will also ensure that your diabetes is getting controlled. So few things, what I have mentioned already in the slide, you can take them as well, but obviously you need a personalized nutrition, just to ensure that you're taking into consideration all other lifestyle factors as well.